Hi everyone, Alexandra here with MDPen. Thank you for tuning in for today's YouTube live video. We are still talking about smoothing the skin, and for today I wanted to talk about smoothing stretch marks. Stretch marks are a huge concern and often a reason people are interested in microneedling. It is definitely one of the top treatments for smoothing stretch marks. Let's go ahead and talk about what a stretch mark is. So a stretch mark is basically a stretching of the skin that leaves almost a scar-like appearance. Typically, over time, they do turn white and tend to have an iridescent look to them. They are a divot in the skin. They are an area where the skin failed to produce elastin and collagen. Stretch marks can come from puberty. They can come from any rapid growth spurt, rapid weight gain, also from working out, building a lot of muscle. We've also found that the hormone cortisol and people that have more of this in their system can be more likely to develop stretch marks. Over time, stretch marks tend to fade from a dark purple upon first appearing into a white, more sheer color. Oftentimes you can feel a stretch mark, and that's a great way to see that they're not smooth. When you feel over them, you do feel that divot or indentation in the skin where the elastin or collagen has failed to produce itself. Now, when we think of microneedling stretch marks, there is a different technique for treating them, which I won't dive into too much in this video. If you guys do have more interest in it, please let me know in the comments, and please do like and subscribe if you're interested in this topic. When you microneedle a stretch mark, of course appears as a linear striae mark. And when you needle, you don't just want to treat the stretch mark by needling into it or just stamping the stretch mark. You want to treat the broad area surrounding the stretch mark. It is just as important to treat the surrounding skin as the stretch mark itself. So there is a technique for this. At MDPen, we do still teach the crosshatch method. And of course, you can go in and stamp stretch marks. Our goals are to decrease the size of the stretch mark, to get the texture more smooth, and of course to build that collagen so you're not feeling that divot or indentation in the skin. Stretch marks can appear anywhere really on the torso area, almost anywhere on the lower body, abdomen, flanks, anywhere. So they are troublesome. They are more difficult to treat. So these do fall into that scar category I was speaking about last week, where when you needle them, you really need to be at a certain depth. You do need to do a certain number of treatments, and your patient or client really needs to be committed to these treatments. Now at MDPen, when you do needle stretch marks, we do recommend using our cellular renewal serum as the treatment glide while treating. This is a gorgeous serum. This is also great for the face. This is a healing serum. It's an anti-aging serum. It has red algae, knotgrass, and aloe in it. And it also has protectants from sun damage, environmental damage, UVA, UVB. I do see a question, how would you know if stretch marks are new or old? Great question. So depending on your skin type, and you will know what color your stretch marks typically show up as. On most people, they do show up darker initially. So it could be a broad range from pink to dark purple. Also, they can be itchy as developing. So if you feel that itchiness in that area and you see the stretch mark developing, this is a newer stretch mark. As they start to fade on most people, they will eventually turn more white or at least a lighter shade next to your normal skin color. They will fade lighter. They are more prominent and noticeable as they are new. One thing I will say, which is never the answer, and we know this as skin professionals, do not tan. People have this illusion that tanning will make their stretch marks less noticeable. It really doesn't, because the sun or the rays or the tanning bed or whatever you're doing does not hit that stretch marks, which is a divot, into the skin. So they actually become more noticeable. They do not turn the same color as the surrounding skin. So definitely don't do that. Oh, thank you guys. I'm so glad you're enjoying this video. If you scratch stretch marks, will it make it worse? I wouldn't say it would make it worse unless you're really digging in there. I would try not to scratch it. Things that can help are moisturizing, of course. There's different arguments about whether things like shea butter, vitamin E, things like this can help stretch marks, coconut oil. However, it can help with that relief of itching. And of course, if you're pregnant, there's only certain things you can use on your stretch marks or to moisturize them. Outside of pregnancy and breastfeeding, you can use a lot of other things. I do recommend consulting with your dermatologist. I know in some cases they will tell you that you can use retin-A or tretinoin in small amounts on your stretch marks. This makes sense because we are trying, it's a way of exfoliating, but also turning the skin over so we can really boost that collagen and elastin. How many microneedling sessions are needed for stretch marks to fade or lighten up? So this can really depend on the person, the stretch marks, the way the body responds. I like to underpromise. I tell my patients or clients it would be probably 6 to 8 treatments on most people. That's not to say I haven't had people at 4 treatments that are really satisfied or happy with their results. Of course, you can use PRP with stretch marks, and I'm talking both topically. And in my case, there was a nurse practitioner who worked closely with me, and she would inject the PRP into the stretch marks, which could really help. And this particular patient that was satisfied after 4 treatments, but I believe she had 3 out of 4 of her treatments done with PRP and microneedling. I think maybe her last one, we did not use PRP. However, you still want to use growth factors after microneedling stretch marks. And at MDPen, our protocol really is not that different besides the technique, which I previously mentioned. So as soon as you put your pen down after you've treated stretch marks, you're still going to go in with our HA copper mist. This is going to help that mild sunburnt feeling, any feelings of inflammation. Usually the patient or client is still pretty numb, but it does help. And it has the zinc, copper, magnesium in there and the HA. But you're going to go in with your human-derived growth factor gel. And as the provider, gloved, of course, you will put this onto the stretch marks. You can even lightly massage them in a little bit. Getting these growth factors into those open microchannels is going to be perfect. We are humans. This is a human-derived growth factor gel, so it's going to work even better, neonatal and adipose. Bill, if you are interested in this growth factor gel, you can definitely reach out to MDPen. You don't have to be a professional to buy this. We do retail it on our website in this size and a smaller size as well if you are interested. And after you've applied this growth factor, you can definitely cover the area with cling wrap so that the patient is able to get dressed and go home. What MDPen products do we have that can help with stretch marks? So I would definitely say the growth factor gel and also the cellular renewal. I would say you would only want to use these if you're already consistent with doing something at home. These are gorgeous products. So you want to make sure you're actually using them on your stretch marks. The growth factor is a higher end product. It is not cheap. So you want to make sure you're compliant if you are using it. If you are someone who did get that retin-A prescription from your dermatologist or tretinoin, I think this would pair really nicely with it. Or if you're someone that doesn't want to just use plain old shea butter or whatnot, that would definitely help. Does exfoliating help reduce stretch marks as well? Yes. So you don't want to overdo it, but when you're in the shower, you can definitely do a light exfoliation, whether you're someone that likes to use a mitt or an actual sponge. But you can exfoliate the skin. You don't need to overdo it. And of course, products, like I said, like retin-A, tretinoin that do exfoliate are going to help turn that over. But stretch marks are difficult. There's only certain treatments that do work. You have to be committed and everything like this. Of course, if you can catch them early, I would say topically, if the stretch marks are old and have been there for, decades or a number of years, the topical treatments are not going to work as well as catching them earlier. So within, probably fresh to 3 years, that's when I would do the topical treatments. Does massaging also help? That's hard to say. I can't be the judge of that. I'm sure it would help with your lymphatic system and getting things going. But I would not promise that that could help with the appearance of the stretch marks. However, massaging the growth factor in very lightly after the treatment does kind of help drive it into those micro channels, which is where I, briefly mentioned that light massaging. I see a question. Can I get that product in Pakistan? You can definitely go to our website, mdpen.co. You're going to go to shopping, go to the retail section of the website, and look up our human-derived growth factor gel. Great question. Any more questions, guys? I hope you've enjoyed this video. It's been on smoothing stretch marks. Again, if you want more stretch marks content, I would love to hear about it. Another thing you can do outside of course, regular microneedling is radio frequency microneedling, which MDPen also offers. We do utilize the intensive NDMed device, and this is a radio frequency microneedling system. It does go up to a 5 millimeter depth. It does have that heat component to it from the RF, so this is going to give an extra tightening while treating the stretch marks. And instead of being at a 2.5 or 3 with the pen, you can go up to that 5 millimeter. So someone doing the NDMed intensive RF microneedling may not need 6 to 8 treatments. Maybe that's someone that's really going to be happy after 4 treatments. There's certain providers that will say that 1 treatment of RF microneedling can be equal to 2 to 3 treatments of regular microneedling. It does have a different price point. They are done 1 month apart, both of them. I think with stretch marks, you can stretch it out to 4 to 6 weeks if you want to do your treatments at 6 weeks apart. So similar to hair restoration, you can go a little bit longer in between treatments if you desire. But if you're healing really well and you're ready at the 1 month or 4 week mark, you can do your next treatment. So definitely look into RF microneedling for stretch marks if that's something you can find in your area and you're interested. You could get faster, better results if you are using RF microneedling. However, MDPen does work really well. And if you're interested in this device, you can also reach out to us. Thank you so much, guys, for tuning in for this video. Of course, I will be on YouTube Live again next Tuesday, 10 a.m. Eastern Time, and I hope you can make it. I'll see you then. Bye.